Hey there, health and wellness fans. Welcome to episode 8 of the YCast. The podcast is revolutionizing the way men think about their health and wellness and their life, one conversation at a time. I'm Tony. Across from me is Rob.
Tony, how you doing today, buddy?
You know,
doing all right.
We had a guest.
We
don't have a guest.
Yeah, that happens. So these doctors sometimes have to patients first, right? They had a patient emergency.
Which
happens.
So we have to be prepared for these live shows.
So people are stuck with us now, which may or may not be good.
Yeah.
We'll see how it goes.
So Keith, what do you got for us? Tell us about erectile dysfunction.
Exactly.
Well, what do I do? Sorry. No.
Yeah. Well, I mean, look, at the end of the day, we got some good information.
Yeah, we
get out there tonight.
Yep.
And we'll give it to you the best way we know how. We did change the camera angles. What do you guys think?
Yeah, we did change the camera angles.
I like it.
Yeah.
Could see your handsome face now. A little better.
I think so. Yeah.
So, unpacking men's sexual performance and overall health. So, we're going to go over a few different topics today. Obviously, like erectile dysfunction.
Yeah.
Hormonal therapy, HRT, and what was the last one? It was infertility, I think.
Yeah, we talk about hormone therapy and male infertility and kind of the rise of that in recent years and why.
Yeah.
So that's something to talk about. Absolutely.
Yeah, and I think there's a lot of confusion, especially like for the testosterone thing.
Yeah.
I think that's one thing. If you're new to it, we should clear it up as far as like common causes and the confusion with. I think there's a lot of guys out there that think like, when you're getting testosterone, that you're taking steroids.
Right. That's a very big misconception. Absolutely. They think they're going to, get huge muscles and bloated and
pimples on the back.
That's not
all that.
Yeah, that's not the case.
So maybe we can clear some of that up tonight.
Yeah.
So we'll do our best to do that. I mean, so basically I would say the biggest thing right now is erectile dysfunction.
Yeah.
I mean, we see the commercials for it.
It's a big, the market's booming right now, which is kind of the reasons we'll go over, right?
Yeah.
There's definitely a cause and effect here.
Absolutely.
Which we'll talk about a lot, and cover. The interesting thing is, we get asked all the time because we're in the health industry, right? We're in the health field. So we get asked all the time by guys, about, fitness and testosterone, but guys don't want to talk about this subject.
Yeah.
It's kind of this, they're embarrassed most of the time but more and more people, and I think you've noticed this because we do work on some of those products that are out in the marketplace. More and more of those people, men are actually now talking about it.
Right.
And asking, what can I do? Right.
Well, I think when they understand the whole mechanism of what the drug does.
Right.
Then it takes down that ego a little bit.
Sure. Absolutely.
Like
absolutely.
it's not, you're not doing anything wrong. Right.
That's right.
It's a medical issue.
Yeah.
But I would say, as far as like the common causes and stuff, I think that's one thing we need to, expand on and, just let people know common issues. So it's just so, you're going through it, affects millions of men. I don't know. I mean, I kind of feel like it's happening more.
Yeah.
Do you feel it? Because I know it's, and we'll get into it, but I know there's like some high blood pressure.
Yeah,
and things
definitely.
Like that.
Well, I definitely think it's happening more, and it's the core. Yeah, great correlation between our, America's health, right?
Yeah.
We're going downhill. Diabetes is up.
Yep.
Obesity. So these are all causes of high blood
Cholesterol.
pressure. Yeah, high cholesterol. Cardiac issues. So as those rise, more ED issues will rise. There's no question. Will not rise. Pun intended.
Yeah.
But it's absolutely directly related to the health, right? And kind of I'll call it the epidemic in the U.S. With increased obesity, increased diabetes, type 2 mostly, obviously. Again, that's environmental and what you eat and lack of exercise, but all of that correlates to ED.
And even psychological.
Yeah.
Because I know we're going to get into the stress aspect and things like that.
Absolutely.
But I would say, guys, me being one of those guys and, trying to learn from that perspective of, if you've never taken any ED medication, if you're out there and you're having trouble, trust me, the guy next to you is taking it.
I would agree. Yeah, that's
Yeah.
right. That's right. A big percentage. What was interesting to me is looking at some of the research on ED medications. You always think, or at least I used to think, okay, it's probably 45 and up that's
Right.
taking it. But actually, it's really not. It's
Yeah.
younger adults taking it too, more for performance maybe, but they are taking it, and they're taking it, 25 to 45-year range has a huge increase in taking the ED.
So do you think that is a product of, younger people having more underlying physical ailments, or do you think it's because of the, performance aspect of it? Because the performance aspect of Viagra is incredible.
Right.
They both have their advantages, but it could be either or.
Yeah, that's why it's tough to really pinpoint that. I think there is a combination of both, to be honest.
Right.
I think people are also, they're stressed more. So, I think the psychological plays a lot. I don't think 30-year-olds and 25-year-olds have probably the disease issues that we're going to discuss as much in, as far as population wise.
Right.
But they definitely have, anxiety. People have anxiety.
Right.
And people are stressed. We could talk about that. We'll talk about hormones and balancing those later. But
obesity too. I mean, that's
that's what
huge.
Absolutely, obesity is growing up exponentially.
Yeah.
And that's definitely, so you're going to see that, I think, continue, unfortunately.
So why don't we go into some of the physical causes? Let's start with cardiovascular disease, right?
Absolutely. Yeah. So and that's actually, a great place to start, because if you are having trouble, that can be a sign of cardiovascular disease, right? And a lot of people don't realize that because they don't understand the correlation between blood flow,
right?
And
wait, before you go, explain what the drug actually does.
Yeah. So the drug helps dilate, vasodilator in the arteries. And,
so we're talking about what? We're talking about Viagra.
It could be
we're talking about tadalafil.
There's others. There's Levitra. Yeah. And there's some generics out there. But that's basically used to increase blood flow.
Right.
So two different areas.
Right.
And because of that, you're able to perform and you get ED. With high cholesterol and cardiovascular disease, that your blood flow is not ample. It's not at all. So you're not getting that dilation and blood flow to the area you need it during that time period.
Because you could, technically you could build up plaque the same way you build it up in your heart. Although in
the arteries, right?
In the arteries.
Yeah.
And the arteries are, I would assume they're probably smaller than.
Yeah. As you get towards, the extremities, right? They get smaller, the larger arteries.
The nether regions?
Exactly. Yeah. Exactly. So, and veins, also, they all play together because now blood has to flow back to the heart.
Right.
So the less, circulation because of cardiovascular issues, the less likely you're going to be able to perform. So that is a big issue.
Right.
But again, if you do have ED and you're 40 and up, I think that you really want to get a check.
Right.
Get checked up on the cardiovascular side.
It's an indicator.
It definitely is an indicator.
If you're having trouble, it's throwing up a red flag.
It is. Yeah, absolutely.
So it doesn't hurt to go and get like physical.
It doesn't. It's actually really important to do that.
Yeah.
Especially if you're having those issues that young, because 40 is pretty young still, 35, but it's happening more and more. So I definitely think you should go get checked.
Right. And then
not you personally, but if you want to, you can.
Yeah. I'm going. I got an appointment right after the podcast.
There you go.
Diabetes.
Yeah, diabetes is another one, and as we know, that also affects your cardiovascular.
Yeah.
So we go right back and kind of it's a loop, right?
Right.
It affects your arteries, absolutely. So you're damaging vesicles because of that overload of sugar,
blood sugar,
blood sugar increase. So again, it's going to affect the nerves. You're not going to get the feeling that you get. That sense you need nerves for the muscles and the blood and all that to perform.
Yep.
So all those issues come into play, and that's another complication with ED. And a lot of times, ED medications don't do very well, even for diabetics. Right?
Mm-hmm.
It helps, but it doesn't. You have an issue. You got to fix that issue. So you got to control the diabetes first, and that's really the bigger point.
Right.
Yeah.
So a lot of these physical causes are, like you said, kind of repetitive, but at the same time, we'll mention them just so everyone knows.
Yeah, that's fine.
So high blood pressure.
Yep.
Kind of the same thing. Chronic high blood pressure.
Yes.
Like you said, was damaging those.
Yeah. So when you have high blood pressure, obviously pressure on a pipe too long, it bursts. But in this case, you basically you get too elastic, right?
Right.
So it's not bouncing back elasticity in the arteries.
Right.
So because of that decreases blood flow as well.
Yeah.
Because now you're really, the pressure's high. It has to go high to pump the blood, and the blood's not really getting through as fast as it should. So.
Right. And then, like we said earlier, high cholesterol.
Yeah.
The buildup of plaque.
Yeah. Yeah. Plaque itself hinders that flow and sometimes can stop the flow.
Yeah.
Completely stop the flow.
Right.
Which is issue, right? So you get that blockage. So you definitely have to be aware of that. If you have all those, and a lot of people that have cardiovascular disease have a lot of these other issues, right?
Right.
They definitely correlate with each other. So.
Right. And then the other one we mentioned was obesity.
Yeah, obesity. Yeah. And that's what a lot of these young kids or young people that are taking ED come in as well. Because obesity, again, you're going to have lots of issues. Again, hormonal imbalance is a big deal. You need testosterone.
Right.
That's the most important male hormone for this, right? Functionality wise.
Right.
And then you are fighting your blood flow again. And, when you're obese, you're definitely going to have the other issues like, blood flow, cardiovascular.
Well, I think it's interesting that the abdominal fat, excess abdominal fat produces the estrogen.
Yeah.
Which further disrupts that hormone balance.
Right. Well,
and that's the thing.
They steal from each other, right? Receptor sites.
Right.
That's the problem. So the higher your estrogen as a male, the less you perform as a male.
Right.
You want to keep that testosterone higher. You need estrogen. Estrogen is not totally a bad thing.
Right. Of course.
You need very small amounts, but you do have to balance it. And men need that testosterone much higher. And then stress itself can induce that too. If you're obese and you have stomach issues because of that, that also increases cortisol levels.
And that's something I think all men are struggling with.
Yeah.
Holding that fat down their abdominal side.
Abdominal fat. Yeah.
You just get to an age where I never struggled with that.
Right.
I mean, maybe just because my body shape a little bit, but once I hit a certain age, I think maybe 40, 45.
40. Yeah.
Right.
40. Okay. Yeah.
It's like, man, it doesn't budge.
Yeah. Yeah. And again, that probably correlates to your hormone balance.
Yeah.
It really does. No matter what even if your testosterone is at what they say normal is, and we're going to get into testosterone a little bit more later.
Yeah.
I don't want to jump the gun, but you still could have hormonal imbalances.
Yeah.
Right. So it doesn't necessarily mean you have low testosterone. It just means your balance is out of whack.
Right.
So yeah.
Is there any genetic component to ED other than the correlation between heart disease and diabetes and stuff like that? But is there any direct?
Not that I know of. I think it's really, it's basically disease manifested. So you could have injuries and things like that, but genetic, no, not really. Except for like the diabetes, type 1 diabetics,
right?
They're still diabetics, right? And that does happen, and people that are born with cardiovascular issues, genetic factors, such as cholesterol. Yeah. So I guess, yes, indirectly,
If
that makes sense.
Yeah.
Okay.
That's what I was told. My cholesterol is genetic, and
but you got yours down even pretty.
Yeah, I got it down.
You got it pretty good. You did a good job.
Stop eating all the cookies.
Yeah.
That helps.
Yeah.
Now I just eat chocolate.
Well, and that's the thing. We say it's genetic, right?
Yeah.
And you were looking at, just to talk about cholesterol, because it is important for ED. We talk about cholesterol being genetic, and a lot of times doctors will go to that first. They'll say, it's genetic, so you really can't do much. But the reality is, and I think we talked about this at a earlier show, reality is you want to look at, what environment you were born in,
right?
And what food you were always eating, and are you still eating it, right?
Yeah.
Because if your family had high cholesterol, there's a reason maybe at that point, right? I bet you if you go back and do a retrospective, not that we could do this, in the 1700s or 1800s, I would probably guess that most people had lower cholesterol, right? And it really has to do with our environment and food. Then maybe the genetic factor sets in. But,
right.
Yeah.
And then this one's interesting: neurological disorders. I guess I never really thought about that. If you know.
Yeah. Well, signaling, nerve signaling,
Yeah.
From obviously from the penis gland to the brain, is really crucial. And things like Parkinson's, MS, ALS, obviously, any neurological disease, can definitely affect even lesions that, you know, a non-diagnosed lesions could really affect, you know, erection, right? So ED in men, so no question about that. Because your nerves have to signal that function.
Yeah.
If it's not signaling, there's potentially an issue.
Yeah, I bet. The this one, medications too is something that, you know, you're taking all these pills and like, how the heck do you know what's disrupting or you know, causing problems?
Yeah. And there are pills that do. So, for example, one of the treatments for men for hair loss, you know, there are side effects. A lot of them actually. The side effects is just that. It's basically erectile dysfunction. And it does affect, because again, you're affecting the hormone balance. You are stopping conversion to DHT when you do some of these, you know, medications. With DHT is another hormone, right, from testosterone on a conversion and estrogen. So, but it throws the balance off, and again, you're going to create some issues. So.
No, it's very helpful. Let's go into psychological causes, because I mean, these are obviously things we've talked about multiple times in our past shows, but stress, anxiety, and depression.
Yeah.
You know,
definitely.
I know myself.
Yeah.
I know when I'm stressed, and, you know, I feel it through my whole body.
Yeah.
And I know my performance. I think I'm in tune with my body enough.
Yeah.
Just because I've been in the gym most of my life, and, you know, I'm trying to eat well. I'm trying to take, you know, supplement what I can. And it affects it.
Yeah, absolutely.
I mean,
when you look at stress, right, you got to correlate it back into, again, hormone imbalances too. Because what does stress do? It releases cortisol. And I know I talk about this hormone quite a bit. It's a necessary hormone. You need it at times, you know, for repair and things like that. But really, when you're stressed for, you know, consistently, it's definitely going to affect function, because it's going to wreak havoc on your hormone balance without a doubt. So, and you're going to get more stressed. You're going to get more anxiety from it, right? Because it gets that heightened, that heightened anxiety from cortisol release.
Yeah.
So all of that definitely plays into it. That's one of the toughest things to deal with too, is the anxiety issue.
And I think these things could potentially work in reverse, whether, like, you know, if you're having a cholesterol issue, right? And then, you know, you're not maintaining an erection, and then, you know, you're losing self-confidence of that, and that brings on stress and anxiety, and then it's almost like you're compounding
without a doubt
the issue.
That makes sense.
It exactly does. Yeah, that's a good point. It does compound, right? Yeah. So it exasperates.
And then you bring in, like, you know, social and relationship issues.
Well, I wonder, you know, we talked about younger men maybe having it more often, issues like, you know, is it all this, like, you know, heightened, you know, visual activity on social media? Is it, you know, what is it? Is it, you know what I mean?
It's all got to play a part.
It's got to play a part. And these shows, movies that, you know, make it like, you know, just the whatever everyday occurrence that you're going to be, you know, whatever stuff, you know, it's just, you know, I think that's just not real, and that's a problem.
Well, what gives me anxiety is when you see a commercial online for, like, a pharmaceutical drug. And then let's say the commercial is like 2 minutes. 90 seconds of that commercial are the song in the background, and they're telling you the symptoms.
The side effects.
The side effects. Sorry. I mean, how does that not stress you the hell out?
Stresses me out. That's why natural's better, right?
You know, it's like you're taking this drug to, you know, overcome some of that. Right. And then you're going to now deplete the active ingredient, because now you're like totally stressed.
It's so true. It's so true. And then, then you cause other issues too. Right.
And that brings in, like, performance anxiety.
Exactly.
So you not only you're not performing, then you're losing confidence, and it's just like a deck of cards.
Absolutely.
So I guess at the end of the day, for ED, I would say, well, for all of it, but they're all like underlying issues.
There are.
And it's again, it is a good indicator. Like, men get erections, you know.
So it's an indicator of issues.
If you're seeing, you know, you're having troubles, it's like every day you're probably getting reminded.
Exactly. Well, people use you know, men just in their minds, they'll say, well, you know what, I'm over 50. That's probably why.
Right.
But it's really not why.
No,
it's absolutely the wrong way to think. There's other issues there that if you're healthy and 50, it's not going, that won't happen. Right. So you can't just, you know, chalk it up to being older, because that's not really true, you know. And I think that's the message for men. If there is an issue, get checked, get medical help,
Yeah.
because there's probably other underlying, problems.
Yeah. So I think what you could say is, when you hit the 40s, is like, I would say be very consistent on those annual exams.
No, without doubt.
Because that, I would used to go like years and just not go to the doctor. I need to go to the doctor and just don't go.
Yeah.
Me
too, by the way. I think that's a common thing.
Yeah.
I mean, you'd have to drag me into the doctors if I was
Well, isn't
dying.
this the point of Project Y?
Exactly.
Like this is, and it's funny that you just say that and we're saying it all casually, but this is the kind of how we brought this to light is
we want to put the message out there.
We need guys to, follow suit and
without
take
doubt.
care of themselves.
Without doubt. Yeah.
So that brings us to like, the one things we can advise, like lifestyle changes, right?
Yeah.
Diet, exercise. Obviously if you're smoking, it's 2025.
Yeah.
So stop smoking.
stop smoking if you're smoking. Yes.
Right?
Yes. Yeah.
And
just what does smoking do? Again, you're dealing with your cardiovascular blood flow, right? Yeah. Why would you do that? Right. It makes sense. And over drinking too.
Drinking. Yeah. Alcohol.
Yeah. Alcohol is not good for you. When you're drinking alcohol, all night or every night and every day. And
no one wants to hear that, Rob.
Yeah. Well, hey, it's not. It's not. So that does affect it as well.
Yeah. So again, there are PDE5 inhibitors.
Yeah.
Which are the technical, I guess, terms for like sildenafil, citrate, tadalafil, which is what's the
Cialis,
right?
Yeah, the brand name Cialis, yeah.
So you guys know.
And there's a lot of generic forms now. A lot of these EDs, ED drugs are off patent, so you can find a less expensive product, in the market. You will get some side effects, by the way, no matter what, because you'll get some congestion. I always tell this lesson, right? The anatomy lesson I'll tell tonight, if you want to know it. You get that stuffy nose, because you have erectile tissue in two areas in the body, and we know where one of them is, but the other one's the nose. And
wait, where's the one?
What we're talking about tonight, but so you'll get that congestion feeling, because a lot of times it will actually create the blood flow into that area.
You told me that a few years back. That blew my mind.
Yeah. A lot of people don't know that.
It's like, okay, cool, but man, no wonder why that happens,
right. So you get that congestion. So
and try, and for guys out there too, like if you're taking Viagra, try the other ones, because I noticed for me, they're different.
They are different. Everybody, right? Exactly. You got to find what's right for you. Yeah. Or try the natural stuff first. Not natural stuff, but try natural means.
Yeah.
Right. Diet and lowering your cholesterol, exercise, and just stress reduction. Right.
Yeah.
I mean, that's the toughest thing, is stress reduction.
Absolutely.
Because people just ignore it, and what they do is they'll drink or they'll smoke or they'll do something.
Try to reduce the stress other ways. And
you got
you're adding to it.
Yeah, I agree. Without a doubt.
So I think the treatment would be part of the treatment if you can't get a hold of these drugs, or if you're having trouble getting to the doctor, or insurance or any of that stuff. You can always like talk to someone, or
I mean, doctors offer devices, vacuums, and unfortunately injectables into.
Can you expand on the vacuums, Rob?
It's not your typical Electrolux.
It's definitely a subject I don't want to touch on much more.
I don't think Dyson makes those, but
it does.
It's but they do have products. So but injectables too. I mean, you think about injecting, I can never fathom that. It's like, whoa, I don't want to do that. I'm going to try everything before I have to inject myself. I can tell you that,
Right.
But there is, I mean, a lot of these urologists, and we were going to have our urologist on tonight, except he had a patient issue, so he had to deal with that, which, it happens with MDs, and you got to respect that. But
happens to me every day.
You lose patience. That's something different. But the significance, of ED is there, and that's why they have all these modalities to try to help people, better, have a better life, right? Quality of life, in that area, right? Because when you're in love with someone, you have a wife, and you want to perform. So a lot of these people have tremendous anxiety, and they need help.
Yeah.
So,
and by the way, if you guys want to, read up on this stuff or just, do some research and just kind of validate some of the stuff we're saying. Mayo Clinic has some really good studies, National Institute of Diabetes, digestive and kidney diseases. You can find all this information, but I mean, you can find it anywhere online.
Yeah. Yeah. I do remember, I'm going to tell a little story here.
Yeah.
If you don't mind.
No, we've got time. We don't have a guest. So.
Yeah, we don't have a guest. So I'm going to fill some airtime with a story.
There you go.
So I was studying, pre-med and doing, anatomy, which I like anatomy. So you basically dissect the whole cadaver, right? A person, right? And, so we were in a cadaver room. I was the only one that was able to drink coffee in a cadaver room. Everyone else was like, "What are you, crazy?" And, whatever. But yeah. So
they were talking about you smoking a cigarette.
So never smoked in my life, actually.
Yeah.
But yeah, so we were basically dissecting this cadaver, and I didn't know about these things, and we cut open the penis, and we're basically looking at the nerves, and you have to basically, you graded based on recognition and whatever. Right. And we happened to find looked like to me a Reebok air pump. It was a penile pump.
Yeah.
And this was way back. I mean,
right.
Probably way back. I mean, we're talking about 90, right?
Wow.
1990 or whatever. And they had penile pumps then. And it was basically, and they still do that. They still have them. Yeah. They're a little different. They're a little more advanced.
Yeah.
But they would put do you remember the sneakers, the Reeboks that you pump the tongue and it blew?
Yeah.
Exactly.
Yeah.
So it made your ankles tighter. Well, this didn't make your ankles tighter. It made something else. But basically, it was a pump, and you put it in your abdominal wall, and you would just press on that pump, and you would be able to have an erection based on that.
Yeah.
So it was back then that there were issues.
That's amazing.
Yeah, yeah, it was interesting.
You wonder what else they were doing.
Yeah, I think I almost spilled my coffee when I saw that. Yeah, but it was definitely interesting. Very interesting.
Guy's dead. Now he has a 3rd-degree burn.
And I will tell you this, for smoke. Yeah, exactly. The guy's dead. That's good. That's fun. But one of the other things, just if you're a smoker, we did lung tissue, and we were picking out little pieces of black, char in a sense, right? It was just really hard. Yeah, in the lungs.
Yeah.
And so you could see how that's going to slow down oxygen to the blood, vasodilation, all that. So you can see.
I've seen pictures of like your lungs online.
Yeah.
Smoking. I don't know if they Photoshop some of those. But
I don't know either.
Pretty bad. Man.
Yeah, I've seen it real. I mean, dissected. And
right.
It's not a pretty picture.
Yeah.
It really isn't.
What's amazing is I think I saw like a before and after where someone who's smoking and then they stop smoking, then 6 months after how better your lung actually heals. Pretty good.
The body's amazing, right? Yeah. It definitely clears.
It's its own filtration.
It really is. It's amazing. It does clear up quite a bit. You're not going to undo all the damage.
No, of course not.
But
because it damages other parts of your body.
Well, the DNA, right, and the cellular structure. So that's the issue.
We don't want to mess with those telomeres, right?
You do not. No. I want to lengthen mine.
Yeah, exactly.
I've been stretching my telomeres so I can live longer, but
All right. Yeah. Enough of you stretching your telomere.
Yes.
So let's go into HRT, which is a hormonal replacement therapy.
Yeah. Yeah. We get asked this all the time.
Yeah,
I got it right. Yeah. I mean, anytime I'm doing at conferences where you and I are at conference, or we're talking to people, podcasts, whatever, but men ask that all the time about, what do you think about hormone therapy?
Yeah. And, well, I mean, think about the influx of, I would say, the past like 5 years.
Yeah.
I know it's been around forever.
Yeah.
I think with all the commercials and
it's around
all the health clinics.
Yeah, it's more out there. People are more aware. So absolutely.
I think there's a good balance too. I think you really have to. It's almost to the point now where it's like it's almost like novel.
Yeah.
Like to get it or I think you still have to kind of understand. And you've said this all the time: is get your numbers checked, get your blood checked.
Without doubt, yeah.
And if your testosterone is above a certain level, then you don't need it, right? You don't need it, or
work on natural ways to increase it, right?
Right, exactly. So if you're like 600,
600, you shouldn't do therapy.
Don't do therapy, exactly.
Right. But the real, people think, okay, I went to the doctor. You go to your regular doctor, your general practitioner, right? And they do your blood work, and they say, okay, you're perfect for your age.
Right.
I never want to hear that.
Yeah,
that's exactly what they say.
Because perfect for your age, that's you're not helping, offset aging or
Right.
offset the
Right.
effects of that, right?
Right.
So you don't want to be in that level.
Right.
You want to be perfect if you were like 25 years old.
Right.
Right. So the average, what's that average number there? Because that's part of the anti-aging. That's part of hormone therapy. That's what it should be doing. But a lot of doctors just are gun shy. There was a lot of like bad research out there or even some bad media. Oh, well, it causes cancer. Well, no, not on, now hormones, estrogen can cause cancer.
Right.
There's estrogen loving cancers and there's testosterone. But the reality is it doesn't cause cancer. You're not going to get cancer because you did testosterone, right?
Right.
You're not going to, you're not, prostate cancer is the big thing, right? Everyone looks at it like, well, check your PSA levels constantly. You should anyway, because anytime you're adjusting hormones, it could have an effect, right? No matter what. But they go right to that. Or I'm going to get too big. I'm going to get muscular, and I don't want to do anabolics and lose my hair and get pimples all over my body and back. And so those are some of the fallacies out there.
Yeah.
But if your testosterone is like 200, you might want to get, and you're feeling depressed, or you're gaining weight and you can't lose it, and you're, there's lots of issues, right? You have mental fog.
Yeah.
I mean, these are all signs of, testosterone deficiency.
Right. And there's dangers of testosterone being too low too, right? I mean,
cardiovascular dangers. Yeah, because remember, muscles need testosterone, including smooth muscles, which so the heart is a muscle. We know that. So testosterone does help a lot of these features and functions.
Right. So let's talk about those benefits, right?
Yeah.
I mean, just off the bat, we can say improved energy levels, better mood. So you're not getting that roid rage.
Right. Right.
Which most people are.
But if you are working out a lot and you haven't gained any muscle, if you do take testosterone, it's going to help you. Like you were 20 working out, you gained more muscle.
Right.
And remember,
because it's giving you that energy, it's giving you that extra fuel you need to build that muscle.
Yeah.
Not necessarily.
It's the energy, and it's but it's the multiple components. But you're right. It's the energy, but muscle needs testosterone to grow. Right. It does. So so it's directly related. And remember this, we talked about this in the past, that you are losing muscle. After 30, you could be losing, 1% every year if you're not working out. And if you're working out, you could still be losing some. Right. So just take a look at the hormone level.
So if you're incing which you should be increasing your protein and making sure.
Protein,
So it helps with that
protein synthesis. Yeah, absolutely. Okay. Awesome. Without a doubt. Yeah.
And then obviously enhanced libido.
And that is actually the first thing that you get your heart checked, you get cholesterol checked, right? And you make sure you have no neurological issues. I would at the same time check my testosterone levels.
Yeah.
And then I would check my PSA levels too. All that at the same time. So you have a baseline on your PSA. But don't just test total testosterone. Free testosterone is one of the most important things to test for, because that's the usable testosterone, free testosterone. So if you're testing for that, then you have a better knowledge and a better baseline to go after.
Right.
And estrogen levels.
Yeah.
So.
And everybody wants a better sexual function.
Yeah, absolutely.
Here's interesting. I didn't know. Improved bone density.
Yeah, because you're improving muscle. So muscle obviously increases bone. The more muscle you have, the thicker your bone has to be to support the muscle.
Gotcha.
It's it's in physiology, it's called Wolvian's law.
Yeah,
it basically builds the bone better.
Right.
So the more muscle, the more bone density.
Excellent.
Yeah.
Well, Keith, who needs a guest?
Right, exactly.
Mr. Rob Davidson. Speaking of Rob, let's start talking risks.
Yeah, I am a risk. Oh, wow.
Did that joke just fly over your head?
No, I got it.
You made the same joke.
Okay.
Thanks, Rob. Give me
I agreed. I said, yes, I am a risk. A joke. I am a joke.
Well, you said earlier prostate enlargement.
Yeah.
Potential prostate cancer growth.
Yeah. And again, if you're checking it, if your PSA is getting a little bit higher, and you feel or you're getting a large prostate, even if it's benign large prostate, a lot of times they'll give you an anti-aromatase, which is something that doesn't allow testosterone to convert as much to
is that
estrogen and DHT.
Yeah.
So I'm sorry.
No, I was going to say, is that a form of estrogen, or
it will block estrogen?
Block
block the conversions.
Gotcha.
Yeah.
Okay. Here's something I think I have is sleep apnea.
Yeah. Oh, I'll tell you, did we talk about that sleep for ED? I mean, forget, sleep apnea with testosterone, but you can get it from testosterone. That is true.
Yeah.
But, if you have sleep apnea, that could affect ED too. So you got to be, there's a balance there.
Yeah.
We talk about that. But yeah, it can, for some reason, it does increase your potential to snore or have mild sleep apnea most of the time, but you can have sleep apnea.
I noticed there's some nights where I feel a little more stuffy than others.
Yeah.
And I've been trying those nose strips,
the breathe rights or something.
It's pretty good. Like, I won't snore during the night.
I wear them when I'm pretending to be a professional football player, but they're actually pretty good.
You've been on the injured reserve, Robert, 37 years.
Exactly.
Time to hang
Should
up.
I hang it up now?
Hang up your shoulder pads. Okay. Yeah, sleep apnea, I think, is something that's very common. People don't even know they have.
Yeah.
But it is very dangerous.
Yeah, I mean, the only way you really know is if your wife's waking you up. Well, or your wife's waking you up, or your girlfriend.
Yeah.
And you sound like you're drowning, or you stop breathing almost.
Yeah, exactly.
So, and it is dangerous. There's no question about it. But there's a lot of tools now to let you know that your sleep patterns, like even the watches they have and the rings and stuff like that.
Right.
You can monitor that a little bit, because if you see multiple disruptions throughout the night and you don't remember waking up, that's likely some form of sleep apnea.
Right.
So it's good to look at those, your REMs and your cycles. So
the rings, I have the ring. The ring's awesome.
Yeah.
It's really good.
That's good. And the feedback is good for that, you think?
Yeah. It monitors your heart rate, just your overall sleep pattern. It's really good. It's probably one of the better investments. I have the Apple Watch, but I can't wear a watch when I sleep. So the ring is the best option. So
so the ring, literally like a ring goes around your finger?
Oh, okay. It's called the Aura.
Aura
ring.
Yeah.
I should look at that.
Yeah. It's very cool.
Yeah, it is interesting. I can't wear a ring only because I get a rash on my finger.
Yeah.
I don't know why. I always get I tried everything, but it doesn't work. Because I would wear that. I don't want to wear like an Apple Watch or something.
Right.
I like my watches.
It makes sense. Yeah. So we're talking about risks, obviously. So increased.
We got a question if you want to answer first. Please define sleep apnea.
Sleep apnea.
Yeah. You want me to do that, or you want to go?
Yeah, I think you're the guest, Rob.
All of a sudden, I'm the guest. Okay. All right. So sleep apnea. It's not just snoring. Sleep apnea is actually losing oxygen or even stopping breathing at certain moments during your sleep, and you kind of sometimes wake up gasping. Some people claim it feels like drowning.
Oh yeah, I've done that. Plenty of times.
Right. You're like gurgling almost.
Scary as heck.
And exactly. So it's not just snoring, but snoring does also affect your sleep patterns. But sleep apnea is a little bit deeper than that. It happens many reasons, but it has to do with either the soft palate. It has to do with sometimes your weight. If you're heavy, you definitely have a tendency to have sleep apnea. But
at least when you're snoring, you're alive.
True, that's true. Yeah. Sleep apnea, you might not even be snoring. You just wake up choking, or wake up like you feel like somebody's burying you alive. Which is probabbe not a good feeling.
No, I've had that happen so many times.
Yeah. So you probably have sleep apnea.
Yeah, I think I do. Yeah, I think I do.
Yeah, you should get that checked.
Yeah.
Increased. Put you on a mask.
Hang on a doctor.
Yeah.
No, not having. Increased red blood cell count.
Yeah.
Which testosterone can.
Yeah, and that's dangerous because you're increasing clotting. So the thicker the blood gets, the thicker, the more red blood cells you have. Great if you're an athlete because you can carry more oxygen.
Yeah.
Just for those athletes out there. But that's why they ban it, right? For muscle and oxygen, but not quite like what Lance Armstrong was doing, but similar.
Right.
But yeah, so you do have to watch out. You got to keep your you take blood tests every 3 months if you are on it, on testosterone or any hormone replacement. Women should do it too if they're doing estrogen or whatever. And progesterone and testosterone, combinations. but very important to get blood work on that and take a look at those red blood cells. Absolutely. Yeah.
And then we talked about this earlier, acne and oily skin.
Yeah. Yeah. Very rare though.
Yeah.
It depends on dosing. So if once you get your dose balanced, you typically won't have that. Now everybody's there's exceptions, right?
Right.
To the rule, but yeah, it's less common.
Yeah.
But
I think of like what we were talking about earlier.
Yeah.
If like you're over like 500-600 and you keep taking more and more, you're probably a bit higher risk.
Well, people, that's the problem. People always think more is better. So even the ones that are at 200, and then the doctor tells them take 0.5, whatever, they end up saying, well, I felt good there. I'm going to go 0.7, or whatever.
Right.
So it's
just keep titrating yourself.
Yeah.
Almost.
And they do. A lot of people do that. So you just got to be careful with that.
Right.
And monitor it.
Testicular shrinkage.
Yes, this definitely can happen. You could take, there's some other counter hormones to that to offset that. Right. But that happens. If you want to have kids, you probably shouldn't be taking testosterone replacement, or if you do, they can do, they give you a follicular site, hormone stimulators and stuff like that. But that's a whole nother show, by the way.
Right.
Well, it goes through infertility if you want.
Yeah.
But so it's it does have that potential.
Mm-hmm. Yeah. Mm-hmm. And then as far as the cardiovascular risks, I know I was reading there's definitely studies out there, but there's no direct correlation yet, I think.
Yeah, but there's also studies showing that, testosterone replacement for people that have low testosterone actually increases cardiovascular efficiencies. Right. So there's multiple, again, I think the cardiovascular risk is probably directly related to the high red blood cells.
Yeah.
So if you're checking that, I think you're going to probably offset the cardiovascular. That's just my I'll call it postulated theory or hypothesis.
Yeah.
But, I do think you do have to be aware. There's always potential risks, but there's no definitive correlation yet on studies for, cardiovascular problems.
Right.
I think they're still being studied.
Yeah.
So, but there's some studies that show, again, like I said, strengthening of the arterial wall because of testosterone, better pump function in the heart. Right. So there's lots of benefits too. Right. So how do you balance those benefits is always the question, right?
Yeah. So get your blood tests.
Yeah, without a doubt.
Monitor your PSA, red blood cell count, prostate exams.
Yep. Prostate exams, blood
you can
tests.
they have like digital now and
without a doubt,
all kinds of cool technology.
Yeah.
And then guys, as far as like some of the stuff we talked about, I put these references down so you guys can take a look. The Endocrine Society, Testosterone Therapy in Men and Hypogonadism.
Yeah.
You can check that out.
And that's low testosterone hypogonadism.
Yeah. And then the Urology Care Foundation for Low Testosterone.
Yep.
Just to back up like some of the stuff we're saying here tonight, so you know. And then you touched a little bit on it a few minutes ago about male infertility.
Yeah.
So like low sperm count.
Yeah.
And I mean, it's a significant concern for men, I would say.
Yeah, I think it's, more so now than ever.
Right.
And you're seeing that fertility is going down, mainly because of environment, though. I mean, there are other issues, there's physical issues, but environmental issues are a big deal, right? So,
yeah.
The plastics, microplastics, they think have some issues. The chemicals, within those plastics. So, you got to be aware of that, so diet and what you're doing is really important.
Right. As far as causes.
Yeah.
So I know like enlarging of the veins.
Yeah. The varicella. Yeah. Varicella. It's, that's a bundle of basically veins in any testicle. Usually it's one testicle.
Oh, yeah.
And what that does, it overheats the sperm and it actually maybe, kills some of them. And it also slows down their swimming ability.
Right.
And you need them to swim. I mean, they're swimming pretty good distance.
No more backstroke.
They got to be, yeah. So they got to be like Michael Phelps, they got to get there. Right. But so that's a problem, but very easy to handle. It's just a small surgery.
Yeah.
No one wants really to get surgery there, but it is an easy fix.
Yeah.
And that's a very common, by the way, reason for infertility. Very common.
Yeah. Infections.
Yeah. Infections. Yep. Like you can actually damage the the reproductive tract, so that could be a problem. You can have scar tissue from infections, things like that, which means again you're blocking the swimming,
right.
Or effective swimming,
right.
Of the sperm. So yeah, that can be a problematic.
And then ejaculation problems.
Yeah.
This is kind of weird.
Yes. Yeah, and that's
the semen entering the bladder instead of being ejaculated.
Yeah.
That's scary.
Yeah. Well, yeah, that's usually
not that you'd even feel it, but
no,
it's
you
still
wouldn't.
like,
But no, you wouldn't. It would just back up, right? It gets
Yeah.
back. But that's directly related to mostly medications, certain medications, and also diabetes has a high incidence of that.
Yeah.
So, I think, if you could control your diabetes, you're not going to probably have as severe of issues with that. So,
right.
And you just got to be careful. You said this earlier. You got to be careful what kind of medications you're taking, right?
Right.
You never know. Yeah.
Well, especially if you start taking like 3 and 4 and you're doing high blood pressure, cholesterol, and all these things, you should like look in, see like
contraindications.
Some of the interactions.
Absolutely. Yeah.
And then hormone imbalances,
which we talked about
in depth.
Much.
And
you pass one, autoimmune disease.
Oh yeah.
Autoimmune can definitely, because autoimmune disease, you're going to have antibodies trying to fight that, and you're throwing antibodies at different areas in the body, just like MS, right, and some of these other Crohn's and stuff like that.
Right.
So you're fighting the body for no reason at that point.
And then undescended testicles, which
is just it's kind of hangs out in the lower abdominal area.
Right
behind right under the inguinal line. Which is right above, and it doesn't function because it's it's up in the chamber.
Right.
It's not coming out to play. So you gotta take a hot bath. I mean that's usually
can you
do, but
can you like hit your head and it pops
jump up and down?
Yeah.
It either goes up or down. I'm not sure, but I think gravity is better. Well,
I'm sure
you could get that fixed though.
Yeah, I'm sure a lot of these are rare cases, but genetic disorders obviously can affect sperm production and fertility. Lifestyle factors, back to smoking.
We talked a little bit
alcohol,
about that.
Drug use.
You affected directly affecting your hormone levels by alcohol and drug use. So other chemicals around you, your work environment could cause that.
That's interesting that you bring that up, like pesticides, heavy metals, things like that you can't control, or you're not even control, just that you don't even aware.
You're not sure. You don't know
that's even happening.
Or you don't know that's the effect of those. Right. You might be aware you're working with pesticides as a in agriculture, but or at your house, right? But you're not aware that this can damage that.
Right.
And again, work environment too. You got to watch out. I mean, we work in chemicals and in pharmaceutical, right? And you just got to be careful what you're working with, because you just don't know, and want to make sure. So,
well, I mean, the thing is to remember, like, you don't want to walk around in life like paranoid about everything, but
you can.
It's good to be aware of your surroundings, and if you're like working in a factory, 20, 30 years of your life that has potential toxins or something. You should at some point, like, if you're having problems with,
I was gonna say, if you're having problems, to your point, now you want to start looking at what you're doing. You got to look at that roadmap, right?
Exactly.
Just so you can decide.
So again, lifestyle changes for this kind of the same thing, smoking, alcohol, weight gain, will help with sperm production, hormone imbalances, and then surgery can be performed.
It can, yes, absolutely,
to correct some of those.
That's the vascular, in the testicle. So surgeries.
So National Institute of Child Health and Human Development, male infertility, and American Society for Reproductive Medicine. You can also check some of that out. So here's interesting. I know you wanted to talk about this, and I think this is pretty interesting for people watching. Is what are the top 5 men's health complaints? Right, because you want to be. I mean, part of Project Y obviously is for men to feel inclusive in a sense where don't be afraid to go to the doctor and talk about a situation.
No, you have to have an open dialogue with your doctor, and you got to, that's why you got to find a doctor you trust. that you feel comfortable talking to.
Yeah, absolutely.
Especially men, they really need that. Maybe they don't want a female urologist. Maybe they do. I don't know. But that's what I'm saying. You got to find your comfort zone.
Yeah.
So
we have like 5 here that we found.
See that. Yeah.
Trouble urinating,
right?
Which I think maybe a lot of guys go through at some point.
Yeah.
I definitely have gone through it. A weak stream, blocked, or and I've had. We're going to get there because it's on the list too. But I have kidney stones. I've had kidney stones for a long time, so I know that it's definitely disrupted my pathway. For lack of a better,
you probably got scar tissue in some areas, and
So that's an indication too if you're dealing with a weak stream or like prostate issues, things like that. Indicate.
Enlarged prostate is probably the number one reason for that urinary flow being low.
Yep.
So again, you got to check PSA, check your prostate size and numbers.
What was that? Put that question back up, Keith.
Yep.
Can you read that?
When I go for blood work, they always have problems finding my veins. What causes that kind of an issue?
That's directly related to circulation. A lot of times cholesterol, and it could be your just cardiac output. And some people, some people have issues with veins. They have smaller veins. Their veins sink instead of float. The temperature can play a role. So if you warm up your arm before you go and get your blood drawn, dehydration, all that can be factors. So there's not one factor that causes that. There's a multitude. Some are environmental and some are just internal. Some of these disease states, cholesterol, or like I said, cardiovascular, vasodilation,
obesity.
Obesity, diabetes definitely does. So if you're diabetic, that's definitely a reason.
That's a great question.
Yeah, it is.
So we did trouble urinating, erectile dysfunction. We don't have to talk about that again, but
we belabored that.
Yes. So we're talking about the top 5 issues men commonly complain about when they visit a doctor, urologist. Blood in urine. Never had this myself, but it sounds pretty scary.
That would be scary, actually.
And like I said, I've had kidney stones for probably going on 28 years now. And I've never had.
I remember you had them every year. And you put out some good sized stones, by the way.
I have some.
I know my dad had that too.
I have some award winners.
Yeah, you do. I like the trophy case in the office. And some are colorful, but it's that has to be painful, no question.
I've got one right next to my Oscar.
The Oscar Mayer Wiener.
The
little car.
Pain is an understatement.
That's
I can deal with them now. I'm taking potassium citrate now, which breaks it down. But I've gotten to the point, even before medication, I've gotten to the point where I could deal with the pain. Really, for me, the pain was always in the back.
Right. Once it gets through,
it's like it still sucks. But I got to the point where I think, like you said earlier, I have so much scar tissue there now.
That's probably true.
That it only lasts a little bit. But for people who are just getting kidney stones, and this is another hereditary thing that I was told I'm getting. It's very painful.
It is. Yeah. Well, the story you tell me about when you had your son. I think you said this story, and you were in a Lamaze class or whatever kind of class, or birthing class. And the lady said, none of you men understand what it takes and how painful it is to have a baby unless you had a kidney stone. And didn't you raise your hand?
Yeah, I went like
I think you were very excited.
I was surrounded by women who were in their second or third trimester. And I just raised my hand like this, like really slow. Like, oh, sorry. And I just got like looks. Like if looks could kill.
I'm sure.
So I felt, like, hey, I know what you guys are going through, but I would never say that.
No, you don't want to say that. I think she even said though, and a kidney stone could be worse than giving a baby sometimes.
Well, I remember. I mean, we've all been to the urgent care, the emergency room, right? And I've been there plenty of times when I was a kid, and even in my adulthood, where you go in, you check in, and you sit. The first time I got him, I went into the emergency room. It was full. And I'm like, oh, what am I gonna do? So I check in. She's like, what are you here for? I'm kidney stone. They're like, okay, come on, and like literally took me in.
They know.
I sat for about 3 minutes and then I was on a Demerol drip.
Yeah, perfect. I should do that when I need some pain relief.
You should do that.
Yeah. No, it's definitely.
So they take it seriously.
They do.
I mean,
You have
it's
to.
not a joke.
You have to. It's not fun. That's for sure.
But I've never had blood in urine.
Yeah. Well, that could be infections too. It's not. That doesn't. I mean, it is alarming. It could be cancer. It could be infections, and it could be a kidney stone.
Right.
So you definitely have to get checked right away. Anytime you have blood anywhere, other than when you cut your arm or something, you probably want to get checked. Like coughing up blood. When you go into the bathroom, you have blood, your stool. And then when you urinate, I mean, you definitely want to get that checked.
Yeah.
That's not normal, by the way.
Right.
Yeah.
So then number 5, overactive bladder.
Yeah.
Which just doing a lot of peeing, I would guess.
Yeah. Well, yeah. And that could be prostate again. We talk about this, right? It can be a benign and large prostate that causes that.
Yeah.
But it also can be, you're just drinking too much fluids before you go to bed. That happens. Or your electrolyte balance is off. So you're not holding the fluids in the muscle tissue and it's just running right through. So there's lots of potential reasons for that.
Yeah.
But drink less before you go to bed. That's what I would suggest. Stop drinking so much. Stop drinking all that water or Gatorade or whatever you're doing. I don't know.
No, I have. I think we talked about this last time. I stopped.
Yeah.
Doing a lot better now.
Yeah, that's good. You only get up 3 times a night.
3 times.
Yeah. I don't get up during the night. I'm lucky.
Yeah.
Maybe I get up for other reasons because I can't sleep. But
right.
Yeah.
Can we jump back to testosterone for a minute?
We could.
When it comes to your blood levels, right? When you get tested, if they are high, obviously, I know through experience, your best bet is to go donate blood, right? But
you're talking about your red blood cells.
Red blood cells. Yeah,
right.
That's what I'm talking about.
Yeah.
How often should somebody donate
blood?
I mean,
if your red blood cells are high and you're donating blood every 2 months, you're fine.
Okay.
Every 3 months, probably, because you're probably controlling it. It takes some time for them to build.
Yeah.
So it's not. Curious. I mean, you're not running out of blood. Don't worry.
Right.
Yeah, you won't pass out. drink some orange juice, would you?
No, I mean, but it could be alarming, right? If your red blood cells, your count goes up. I mean, mine never went up that high. They were slightly elevated, but not, nothing dangerous. But I was just curious,
I feel like
one every 6 months or
you can usually. I mean, you want to do it once a quarter because that's your cycle on the testosterone. But I would say you can do it. It depends. You can do it, every month if you wanted to.
Right.
And still not be.
If you wake up tomorrow, Keith, and your fangs are like an inch.
Exactly.
It's time.
Exactly.
And Lindsay comes to you with like a strand of garlic.
And if you notice your blood cells are up high, like your red blood cells, you could take a baby aspirin, every day. And that does help. That does help a lot.
Yeah.
That's a good point.
I want to talk about some of the
What
myths.
if I don't want to?
Well, then we'll have to find another guest.
I'm done. You're out.
That's number 2.
Oh, boy. All right.
Keith is our guest tonight. Welcome, Keith. I'm never going to be the guest.
Somebody has to ask the questions.
Yeah. I love the debunking the myths.
Yeah, I do too.
It's one of my favorite.
I think it's important too.
Segments.
Yeah.
So let's debunk some myths.
Yeah.
I got them listed.
Yeah.
Lucky you, Rob.
I like it.
Did you ever think you were going to be doing this tonight?
I didn't think so. I thought I was off the hook tonight.
No myth debunking for Rob.
Now I got to do it.
Okay.
Right.
Number 1 myth: ED is a normal part of aging, and you did talk about this.
I did say that's a 9. That's no in Germany. But
right.
Yeah.
Well, I mean, it becomes more common with age, but
it does because other aspects, as we age, we're not working out as much.
Right.
Probably.
Right.
I mean, that's just the way the society is.
Exactly.
Cholesterol goes up, and cardiac issues. But
ED is purely psychological.
For some people.
Yeah.
For some people, it's really purely psychological, but I would say for the masses, probably not.
Right.
I would say there's definitely a ratio there. So it's not purely psychological.
ED medications will work for everybody.
No, that's not true either, actually.
Right.
So think about this. You can take, a medication. You still have to have the desire, right? And you still have to have the stimulus, right? So if you have nerve damage, it may not work. It probably won't work, right? You got to fix that issue. You got to, whatever. It depends what nerve damage it is, right? But you have to control that. So it won't work, right?
Mm-hmm.
And then if you have psychological issues and you just are depressed and you don't, there's nothing, or anxiety or whatever, it may not work. It may work. It may give you that false sense of security. It just depends, but that it doesn't always work with that.
Right.
So
right. Yeah, and the other thing too is, like we said, there's different medications out there. So
yeah, that's why you want to.
They work differently.
Exactly. Right. Yeah.
Some of them
different mechanisms,
different half-lives, and different dosages, which could affect
those forms. Right. Exactly.
Right. And then ED is only a problem for older men, which kind of
we said that. Yeah.
So here's some myths for hormone therapy. TRT will make you aggressive and angry.
Not really.
Yeah.
No, it doesn't. Now again, some
can have
people
some mood changes.
Some people can have mood changes because the other hormones are out of balance.
Yeah, and you can equate that to someone cutting you off on the road.
Right.
TRT will automatically cause prostate cancer.
Yeah, we talked about that a little bit earlier. Yeah. But you do want to monitor your PSA, your prostate, because hormones could play a role depending. Right. Especially when they start converting a lot. So, but yeah, that's not true.
Yeah, I think with any, they say supplement, you're supplementing something.
Yeah, you're supplementing. So you got to balance it.
Right.
TRT. By the way, just an important point. That's why not every dose amount or medication is for everyone, right?
Right.
So you do have to find your sweet spot in dosing when you're doing testosterone, and you'll know it. You'll notice how you feel. You'll look at PSA levels. You look at red blood cells. You look at all those parameters: estrogen conversion, DHT, free testosterone, all that you check, and you'll be able to balance that out quite a bit.
Right. TRT is a quick fix for low energy and libido, which we talked about.
It helps with both, but it's not a quick fix.
Right.
There's so many other parameters.
Lifestyle changes.
Yeah, lifestyle changes are important. Yeah, without doubt.
Infertility. Male infertility is rare.
Yeah, well, I wish it was. It's growing exponentially. We talked about that. I mean, again, I would look at environmental, processed foods, plastics. All of this stuff is it's pretty bad.
Right.
So.
If a man can get an erection, he's fertile. Which.
Not true at all.
Yeah, it's definitely not true.
Wishful thinking. Yeah. No, that's not true at all. Yeah. Fertility has nothing to do with ED or erection.
Right.
It has to do with the sperm,
right.
The health of the sperm, the ability to shape, morphology, and then can it swim?
Right.
So
there's nothing you can do about male infertility.
Yeah, that's not true either. You can. Lifestyle changes like we talked about.
Yeah.
Depending on what the cause is, surgery.
There's technologies out there.
Yeah, absolutely. And then, in vitro, fertilization. You can do that. So there's lots of opportunities.
Lots of opportunities and lots of still unanswered questions. We got some more material, but I think we're going to save it for another show.
I think we can. Yeah, absolutely.
Because there's
the
so
hours run out.
There's so much here. We'll dive deep into some of the other subtopics that we have.
I agree.
Break it down and get the doctor back on.
Yeah.
We don't trust you, Rob. Now, thank you, Rob. Great show tonight. Appreciate stepping in.
Of course.
You always step up, man.
I try.
He does.
You too, man. Thanks for stepping in.
No problem.
So, guys, that's going to do it for us tonight. First of all, I want to thank special thanks to RCJ Productions, Keith and Lindsay, our producers, who, if we didn't have those guys, we wouldn't be here tonight. So thank you guys for keeping the show flowing, all the promotions you guys are doing. And guys, if you're interested in opening up your own podcast or doing some kind of technical details with audio, video, things like that, hit Keith up. He's a friendly dude. He only owns a couple guns.
Just a few.
Check those guys out. You can find them online. Keith, where can they find you guys?
You can email us at rcjproduction@gmail.com or find us at rcjproduction.com on our website. So
awesome. Speaking of finding people, you can find us on our socials, YouTube at the Ycast, Facebook Project Y, Instagram, LinkedIn, and TikTok Project Y Now. And want to thank you guys for joining us tonight. And please, if you like the show tonight, please like and subscribe. It really goes a long way. It's going to help a lot of men and we want to see you guys here on the next show.
Absolutely.
You will see us on April 9th.
Yep.
And don't forget, you can download our app. We're still working on products. We're going to be launching that in the next couple of weeks, guys. I promise. Look for us on LinkedIn, Instagram, where we'll show those launch dates.
Yep.
See you April 9th. Thank you, guys. And we're out.
See you guys.
Great night. Yeah.
Thanks.
Yeah.